Hi and welcome to Medicine, Past, Present and Future. My name's Dr. Nick and I'm the past.
And my name's Dr. Isabelle and I'm the future.
And together, we're the present. Now, Dr. Isabelle, I want to play a game with you today. I call it Rash Roulette. Sounds like fun, doesn't it?
I'm not quite sure it's my idea of fun, Dr. Nick.
Come on, don't be such a curmudgeon. That's my job. Look, I want to give you descriptions of 3 different rashes and you've got to work out what they are.
Well, it kind of does sound like fun, actually. All right, let's do it.
Okay, number 1. I'm red, I'm scaly, I'm itchy and scratchy, I'm in the elbows, I'm behind the knees, and I'm affected by the weather. What am I?
So, elbows and knees itchy and scaly. It's got to be eczema, right?
Ding, ding. Yes, eczema. One of the commonest rashes that we get. About 30% of the Australian population will get it, and it often goes with asthma or hay fever. But Dr. Isabelle, what actually is eczema?
So like you said, it's a common dermatitis. Now, Dr. Nick, there's a clue in that name.
Yes, because in medicine, anything which ends with itis means inflammation. So we have, for example, sinusitis, tonsillitis, appendicitis. So dermatitis just means inflammation of the skin.
Yeah, and it tends to run in families. So if your parents have it or your siblings have it, you might also have it. Now, there's no cure for eczema. So some children will grow out of it, but a lot will have to manage it their whole life.
And because there's no cure, then treatment becomes very important, and particularly for what we call eczema flares. So, Dr. Isabelle, what is the treatment?
So it's a moisturiser. Morning and night, just lather it on. And if the moisturiser's not really helping, see your GP for some prescription ointments and creams.
Okay, Dr. Isabelle, I've got number 2 for you. Okay, I've got a 4-year-old. They've got a temperature. They've got spots on the hands, on the feet. Don't want to drink or eat anything. Feeling pretty miserable. What disease have they got?
Oh, so hands and feet. It's got to be hand, foot and mouth disease, Dr. Nick.
Correct, Dr.
And
Isabelle.
I'm guessing that if you open that child's mouth, they wouldn't want to eat or drink anything because they've got nasty sore spots inside their mouth as well.
And that's exactly right. And then what antibiotic would we give them to treat it?
Well, that's a trick question, Dr. Nick. You don't need antibiotics for hand, foot and mouth disease because it's a virus. All they need is plenty of rest, simple fluids, things like icy poles to help with the sores in the mouth. I've got one for you now.
My turn.
Same child as before, 4-year-old. This time they've had a fever a couple of days ago, and instead of blisters on their hands and feet, they've got blisters all over their body.
And what do these blisters look like?
So they started off quite small. They've gotten a little bit bigger and filled with fluid. Now some of them have popped and crusted over. What do you think?
Yeah, I think I know this one because that sounds like chickenpox. And just like hand, foot and mouth, it's due to a virus, so you don't really need treatment unless you're really tiny and sick. And before vaccination, that child might have been invited to what was called a pox party.
A what?
A pox party. A pox party?
Yeah, just saying the name over and over again doesn't help me understand it, Dr. Nick. What's a pox party?
So people used to invite the child who had chickenpox to mingle with all the others so they could all get the disease, get it over and done with, and become immune into adulthood because the fluid in those blisters was so infectious.
Oh, that's so gross, Dr. Nick.
And sometimes they'd even get a lollipop that pox-affected child was sucking and they'd pass it around.
I get the gist. Thank you very much. Thankfully these days we've got really effective vaccines, so no need for pox-flavoured lollipops.